Questions continue to rise as the coronavirus continues to spread. Here to answer some of the most pressing questions is our chief health editor, Dr. Nandi. And Doc, our first question tonight is from Renee. She asks, if you lose your taste or sense of smell, could you be a carrier?
That's a great question, Alan. And Renee, it's a possibility according to the American Academy of Otolaryngology, head and neck surgery. And what they said was that there's anecdotal evidence that shows that anosmia, which is the fancy term for loss of smell, and dysgeusia, which is another medical term for loss of taste, are symptoms that are associated with the coronavirus. And they recommend that these symptoms be considered when screening somebody for the coronavirus. If this happens to you, please don't panic. There could be many other medical reasons why you may have these symptoms, but I would recommend you talk to your doctor first and get tested if needed before assuming you have the coronavirus.
Yeah, some good information there, Doc, for sure. Our next question is from Ariel. She asks, how can you tell the difference in the symptoms of the coronavirus versus allergies, because it is allergy season?
Yeah, it's a big question now because now so many people have allergy symptoms. You know, with allergy season ramping up with warmer temperatures, if you have allergies, you likely have symptoms like a runny nose, sneezing, congestion, and itchy eyes. And sometimes you can even feel like you have shortness of breath. And that can be scary because one of the symptoms, the key symptoms for the coronavirus. So how can you tell what you have? Well, rarely is a runny nose linked with coronavirus, and sneezing is not a sign for it at all. The main symptoms that separate these two, which is spring allergies and coronavirus, is fever. Having a fever is another key symptom of the coronavirus, as well as the dry cough. And it's very rare that spring allergies are linked to fever. Again, if you're not sure, talk to your doctor and get some more guidance.
And our last question tonight comes from Felicia. She asks, is 6 feet really a safe distance, or can you still catch the virus at that distance?
Yeah, we're never going to forget that 6 feet for the rest of our lives, right? But the CDC says that the virus is thought to spread between people who are within 6 feet. This comes from studies from respiratory physiology or respiratory studies. And it's possible that when someone coughs or sneezes, the air that comes out, right, can travel between 3 and 6 feet. So if you're in that range, it's possible to breathe in what someone has put out, what someone has exhaled out, including contaminated respiratory droplets. But the good news is that the 6 feet, and that's why 6 feet should be a good distance, the minimum distance you should keep between you and others. I think if we listen to these kind of guidance from the CDC and your health officials, we can really get on top of this. So I'd encourage everybody to stay on track and keep doing what all the health officials are saying.
Some great information, Doc. It's great to see you, and stay safe.
You as well. Thank you so much.
Thank you. And if you have a coronavirus question for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or be sure to send it to us on Facebook or Twitter.